Today, let's talk about something truly astonishing in the world of cancer treatment. Often, when we administer immunotherapy to cancer patients, we witness what can only be described as miracles: tumors shrinking dramatically, seemingly melting away. One might think, it's all due to the potent medicine, but I'm here to tell you something surprising: it's actually your gut, doing much of the work. Yes, you heard that right. Believe it or not, the 100 trillion organisms residing in your gut play a pivotal role. Your gut bacteria, this incredible, bustling community within you, could be the key factor in determining your response to these cancer drugs. There's growing evidence suggesting that the gut microbiome, this complex network of bacteria, viruses, and other microorganisms in our digestive tracts, has a significant say in whether tumors shrink under the power of immunotherapy. It's a connection between cancer and the gut microbiota that we never expected. I know, it sounds complicated. But in this presentation, we're going to unravel this intricate relationship and show you just how effectively it works in the fight against cancer. As we know, our bodies, including the gut, skin, and other areas, are home to a vast community of microorganisms known as the microbiome. This microbiome isn't just a passive resident, it's actively shaping our immune system, which is a complex network, crucial for defending against harmful agents and maintaining internal balance. Particularly interesting are the roles of monocytes and macrophages, key players in our innate immune system. Recent research has been illuminating how these cells interact with our gut microbiota, which, in turn, influence our adaptive immune response. Now, let's look into the relationship between our microbiome and immune system. This isn't a simple one-way street, it's a dynamic interplay crucial for both health and disease management. In fact, the microbiome trains key components of our immune system, affecting both our innate and adaptive immunity. And when it comes to cancer treatment, this relationship takes center stage. As we know, immune checkpoint blockers have revolutionized cancer therapy, yet their effectiveness varies widely among patients. One emerging strategy to enhance their efficacy is by tweaking the host's microbiome. It turns out, the diversity and composition of our gut microbiome can significantly influence how well these treatments work. In essence, our gut microbiome is a key regulator in the fight against cancer, impacting everything from drug metabolism to the success of immunotherapy. But how exactly does the gut microbiome exert its influence? It's a multi-step process, involving both innate and adaptive immune systems. The gut microbiome first impacts innate immunity and then the adaptive immune system. This cooperation leads to powerful tumor-killing effects by effector cells, like CD8 plus T cells and natural killer cells. It's a complex dance of interactions, with cells like macrophages, dendritic cells, and neutrophils playing crucial roles in presenting antigens and activating other immune cells. Interestingly, treatments like immune checkpoint blockers can enhance these interactions, leading to more effective tumor destruction. In summary, our understanding of the microbiome's role in cancer treatment is evolving rapidly. It's not just about the drugs we administer, it's also about the mighty microscopic microbiota within us, and how they interact with our immune system. This insight opens up new frontiers in cancer therapy, offering hope for more effective and personalized treatments. Now, join me on this exploration of the microscopic world within us and its enormous impact on real people's life. In an innovative study from Sackler Medical School in Israel, researchers have unveiled a groundbreaking link between the gut microbiome and the efficacy of cancer treatments. This research extends previous mouse studies, revealing that the gut microbiome plays a significant role in the effectiveness of anti-PD-1 immunotherapy. The study involved a phase 1 clinical trial with 10 metastatic melanoma patients who had previously not responded to anti-PD-1 treatments. This trial explored the combination of fecal microbiota transplantation from a responder to a non-responder and introducing additional course of anti-PD-1 immunotherapy. The fecal implants used in this trial were sourced from 2 metastatic melanoma patients who had successfully responded to anti-PD-1 monotherapy for over a year. These donors had their fecal matter carefully collected and processed. The processing involved creating a fecal suspension in normal saline, sieving it to remove solids, and then concentrating the suspension. Remarkably, this trial observed significant clinical responses in 3 patients, including 2 partial responses and 1 complete response. The treatment did more than just reduce tumor size, it also induced positive shifts in immune cell activity and gene expression within both the gut and tumor sites. These initial findings are not only encouraging, but also represent a paradigm shift in cancer treatment, emphasizing the potential of modulating the gut microbiome to boost the efficacy of immunotherapy. In another exciting development from the Hillman Cancer Center at the University of Pittsburgh, researchers have made more significant breakthrough in the fight against melanoma. They conducted a clinical trial revealing that resistance to anti-PD-1 treatments in melanoma patients can be effectively tackled by altering the gut microbiota. This was achieved through a combination of fecal microbiota transplantation from responders, along with anti-PD-1 therapy, in patients who had previously shown resistance to PD-1 treatments. This innovative approach was not only well tolerated, but also provided clinical benefits to 6 out of 15 patients. It led to rapid and lasting changes in the gut microbiome. Those who responded to the treatment showed an increased abundance of microbial taxa known to be linked with positive responses to anti-PD-1 therapy. Additionally, these responders exhibited heightened activation of CD8+ T cells and a decrease in myeloid suppressor cells. There were also distinct proteomic and metabolomic changes observed in these patients. Collectively, these findings are groundbreaking. They demonstrate that, combining FMT with anti-PD-1 therapy can alter the gut microbiome and transform the tumor microenvironment, helping to overcome resistance to anti-PD-1 in some patients with advanced melanoma. In recent groundbreaking research, Canadian scientists have made a significant discovery in cancer treatment. Led by Dr. Bertrand Rudy, the team published a Phase 1 study in Nature Medicine, revealing that fecal microbiota transplants from healthy donors could be a game-changer for patients with advanced melanoma undergoing immunotherapy. As we know, despite the effectiveness of immunotherapy, the current response is only about 40% of melanoma cases. This new approach aims to boost those odds. The process involves transplanting processed stool from a healthy donor into a patient, with the goal of enhancing the patient's gut microbiome. This technique, though seemingly unconventional, has shown promising results in improving the body's response to immunotherapy. The team's research involved giving 20 melanoma patients approximately 40 oral fecal material capsules each, followed by treatment with intravenous immunotherapy, nivolumab or pembrolizumab. Remarkably, this combination was not only potentially safe, but it also led to a 65% response rate, including 20% complete responses. These findings are not just numbers, they represent a potential paradigm shift in cancer treatment. The success hinges on the high survival rate of donor microbes in the recipient's gut, indicating that manipulating the microbiome could be key in enhancing immunotherapy's effectiveness. This study isn't just about the impressive response rates, it's about opening new doors in cancer treatment, emphasizing the untapped potential of the microbiome in combating this formidable disease. Lastly, I'd like to share with you an important study about fecal microbiota transplantation in colon cancer, especially relevant for those with metastatic colorectal cancer. Currently, a notable challenge is that most metastatic colorectal cancer cases are microsatellite stable, and they typically show a low response to PD-1 inhibitors. While immunotherapy has been a transformative force in cancer treatment, this specific group of metastatic colorectal cancer patients has largely been left out of its benefits. To address this, researchers from mainland China explored the potential of fecal microbiota transplantation to make microsatellite stable metastatic colorectal cancer responsive to PD-1 inhibitors. The study dives into the intricate relationship between the gut microbiome and the efficacy of anti-PD-1 therapy. The researchers combined fecal microbiota transplantation with tislelizumab and fruquintinib, seeking to enhance treatment efficacy for refractory microsatellite stable metastatic colorectal cancer. In their Phase 2 trial, patients received this combination as a third-line therapy. The results were very encouraging. The median progression-free survival was 9.6 months, and the median overall survival was 13.7 months. The objective response rate stood at 20%, and the disease control rate was an impressive 95%. Although 95% of the participants experienced some treatment-related adverse events, these were generally manageable. Interestingly, responders to the treatment had a distinctive gut microbiome, characterized by high levels of proteobacteria and lactospiraceae, and low levels of actinobacteriota and bifidobacterium. In summary, the approach of combining fecal microbiota transplantation with tislelizumab and fruquintinib opens new doors, demonstrating improved survival rates and manageable safety for patients with refractory microsatellite stable metastatic colorectal cancer. This could be a significant new treatment path for a patient group that has had limited options until now. In summary, the combination of fecal microbiota transplantation with anti-PD-1 immunotherapy or targeted therapy has shown promising results in the battle against refractory solid tumors, including melanoma and colon cancers. This approach comes as a beacon of hope, particularly for patients who have not had success with previous standard systemic therapies. It's not just about the anti-tumor efficacy, the safety profile of this combined treatment is also acceptable, making it a viable option for those in need. However, it's important to note that these findings are just the beginning. To fully understand and confirm the effectiveness of this treatment, future randomized controlled trials are essential. Stay tuned for more updates in this exciting field of cancer treatment. Thank you for tuning in and joining us on this journey of medical discovery and innovation.